Hi, welcome to this week's edition of PsychMed's comments on Psychiatrist comments on Psych Meds. Getting back to the original format this week of actually talking about a Psych Med, as I've gotten away from the last few weeks. But today I'm going to talk about Valium. The generic name is diazepam. For any of you who are familiar with this class of medications known as benzodiazepines, from the similar sounding names where they end in "pam," many of them. So this is a benzodiazepine, and it has many of the same traits and precautions of the other benzodiazepines, in that it is potentially habit forming. So if you do take it on a regular basis, you have to come off of it slowly. Otherwise, you could have a dangerous reaction, specifically a seizure, that could lead to death. So why would anybody take a medication like this? Well, when used as directed, especially if used on an occasional basis for very severe anxiety, to prevent panic attacks, for example, it can be a very important and useful tool for individuals who are struggling with panic attacks. So it is used to treat anxiety of many kinds, panic attacks, as I mentioned, but also general anxiety. As all benzos, it does have some sedative properties, so some people do like it for sleep. I don't particularly like using benzodiazepines for sleep, for a variety of reasons. The issue that you can become physically dependent on it. So even if you don't need it for sleep anymore, sometimes there's a reason to continue taking it just to avoid the physical withdrawal. And we have a lot of other great options to help promote sleep. And I think ultimately we want to get people sleeping on their own. So it's harder to do if you get used to taking Valium or any of the benzos to help facilitate sleep. It's not unheard of to do so in the short term, but we really try to avoid that in the long term. And then again, along with any benzo, if you're taking it over a longer period of time, eventually it can build up in your system. In particular, diazepam or Valium, because it's one of the most long-acting benzodiazepines. So when it builds up in your system, it can cause cognitive dulling, it can cause some fatigue, and then I've actually noted that patients tend to get depressed if they take Klonopin over an extended period of times. Now, this does not apply to everybody, so if you hear somebody who takes it, you don't have to tell them that they absolutely need to stop. Certain people do perfectly fine taking a particular medication long term. These are just general parameters. So in terms of dosing, Valium comes in, I believe, 2 milligram, 5 milligram, and 10 milligram tablets. Usually, the dosing actually varies according to the patient and their history. If it's somebody new to benzodiazepines, then I definitely will try to start out with the lowest dose of 2 milligrams. If it's somebody who does have a history of taking other ones, but they are switching because they wanted to try something different, because they had a particular issue with one of the other options, then we'll sort of do kind of a loose conversion. And I do go up to 10 milligrams for certain patients. I find that some patients do need the 10 milligram dose. I won't go higher than that in a single dose, and I don't like to go actually beyond 2 doses in a day, because, as I said, it is a long-acting medication. As I alluded to, if you're coming off of Valium, if you've been taking it daily for more than a couple of weeks, then you're going to want to gradually taper the dose. How to do that varies according to, again, how long you've been taking it, what your history is, what other medications you're on, a lot of different factors. So this is definitely something you want to be doing with the guidance of a psychiatrist. And the most common side effects of Valium is related to its effects, which means that it can be sedating for people. As I said, I don't like to use it for sleep anyway, so if people are taking it during the day for anxiety, it can make them somewhat tired, even to the point where they want to take a nap, and that's not the best pragmatic option. But again, that's not the experience that every patient has, but that's one of the potential pitfalls. And this is not really a side effect, but I'm not sure if I talked about this in other videos about the other benzodiazepines, but the other thing about these medications is that they're cross tolerant with alcohol, which means that you don't want to combine them with alcohol because they can accentuate the effects of either one. And in extreme situations, benzodiazepines can suppress the drive to breathe. So you definitely do not want to mix it with alcohol. On the flip side, the medications are often used to help prevent alcohol withdrawal. Traditionally, we tend not to use Valium, but any of the benzodiazepines can be used to prevent alcohol withdrawal. But that's just kind of a side note. Again, not commonly for Valium. There's some other benzodiazepines that are more commonly used for that purpose. Valium is mostly for anxiety and, as I said, sometimes for sleep. If there's anything you feel like I didn't cover, please comment or ask a question down below. Thanks.